Okay, IPL. So that was the intro to skin type. IPL is color correction. If you do not have a way to correct color, it is one of the foundational signs of aging, sun-damaged skin. IPL is intense pulse light, and it targets dyschromias or discolorations in the skin. The new IPL, the Lumecca Peak, is 25% more powerful than the old one that's on the old Optimus. So what does that mean for you? That essentially just means less treatment is required to get to something that you and your patient both like. You guys hang with me. We'll have a break here in about 7 minutes. So IPL looks like this. Look at picture left compared to picture right. This is one treatment. You guys feel free to take pictures of all of this stuff. All of these patients have been consented. I will let you know if it's a picture that you can't take. I have a couple in my Ignite lecture that the patients were gracious enough to do in an educational format, but they didn't want them distributed on social media. So those ones I'll ask you not to take pictures of. But they okayed for me to show you as providers. So yeah, color correction with one treatment. Look at on her cheeks. I absolutely love Lumecca because it's the one real tangible things. A lot of this stuff takes a long time to see results, right? You do the 4 month, it's slow over time. You don't see for Lumecca, you see that night. You see all the sun damaged skin because it rises to the surface. This is immediately after a treatment. See that brown that's popped up to the skin surface? And this will all flake off and leave her picture right with a very smooth foundation and base. Same thing here. Color correction. Age spots. Rosacea in men. And since Donald Trump was running this year for president, he decided to come in and get his IPL. She's like, was that really Donald Trump? I'm like, no. But the first time I saw this picture, I was like, holy smokes, the resemblance. That's pretty close. Okay, red foundations, red ruddy hue, rosacea. Look, IPL gets us from picture left immediately 3 days after to picture right. What is still present? Vessels of caliber. Do you see that? This is still present, vessels of caliber. Okay? And so when you go from picture left to picture right, the IPL will clear the foundation. It will clear the foundation of red, but we still have vessels of caliber that might need to be picked up. So I always say, hey, we're going to start with the IPL for the rosacea, finish with the vasculase for any remaining vessels. You have to do it in that order. The vasculase is so efficient at finding reds. If the whole foundation is red, you can burn somebody up. So clear it with the IPL first, finish with the vascular laser for anything remaining. Or in this instance, this guy doesn't have much remaining. We cleared it all with the IPL. More sun-damaged skin. Correction. This is my wife again. She did her décolleté, chest décolleté, and shoulder last week before this picture, a week ago. So this skin has been cleared. This is the night that she did the remainder of her arm, that night. Look at the difference between cleared skin and just treated skin on everything that rose to the surface that's going to flake off. Surgeons in the room, where are you at? Surgeons, yes. I use my IPL all the time for post-procedure scar refinements. Remember, it finds pinks. So when you have a scar that's hyperemic, you remember that term, hyperemia is just blood flowing to the area, new capillaries forming to try to get that area to heal. That's why you get that red hue. If you have hyperemic scars, my IPL can take this patient from picture left to picture right in a week, rather than making them. It will get to picture right, but it takes, 9 to 12 months to get there. So if they want to speed up that process, just hit them with the IPL. Here's another way I use it, post-scar. This lady was on blood thinners. So we anticipate she could not go off them because of her stents. So she had to stay on them. She wanted a blef. I said no. She asked for it again. I said no. She asked for it again. I'm like, okay, fine. And so we knew she was going to be really, really bruised because she could not stop her blood thinners. She wanted a lower blef. So we walked into it knowing that she was going to look pretty bad day one. And she, proved me right. And then day 7, this is where I'm looking at her saying, hey, we can speed up the bruising. This will take months to clear. So on day 7, I hit her one time with the IPL that's got her to here. And then on day 10, I hit her again. So I did day 7, day 10, and then look, day 14. That sped up the process dramatically.